Trying to meet annual depression, suicide risk, and substance use screening recommendations for teens, all during a comprehensive checkup visit? How about using a platform that automatically reminds teens to complete questionnaires confidentially online, helps them select health goals, scores and interprets the screens, and writes most of the visit note? Chattis can do that for you and more. Just click to launch the patient-specific template to see the comprehensive editable report pre-populated by teen and parent data from questionnaires with priority areas highlighted in red. The report includes all recommended Bright Futures areas asked of the parent and teen, as well as teen-reported life and health goals, and billable screens for anxiety, depression, suicide, and substance use. There are optional aids for individualized motivational interviews and national guidelines for care. If indicated, you can follow the blueprint for suicide prevention guidelines using the Chattis Suicide Risk Assessment Worksheet and even create a safety plan with the teen and family. Other options include scheduling follow-up questions, making referrals to local or remote services with pre-filled consent form for data sharing, and pre-selected individualized handout type messages and resources. After the visit, every teen and parent gets separate private care portals with automatically assigned education, which you can veto or add, plus resources specific to their goals and issues, including chatbots. Want to learn more? Contact us at www.chattis.com.